Many people around the world, the end of this exhausting and challenging pandemic is finally in sight. For those who have lost a loved one due to COVID-19, there is a new epidemic on the horizon: complicated grief and mourning. Due to restrictions on gatherings, individuals and families may not have had the opportunity to properly mourn.
This is particularly true in communities of color who have been disproportionately affected by the pandemic and have experienced rates of death twice those seen in white communities. The loss of these lives, exacerbated by health disparities resulting from systematic racism, may trigger traumatic responses in surviving family and friends.
While access to quality health care is a need in communities of color, networks of clergy, nurses, and other paraprofessionals who support grieving individuals are strong and long established. The effectiveness of the support provided by practitioners could be increased by training them in evidence-based interventions for grief and related depressive symptoms.
The Tribute Program will train community paraprofessionals to deliver interpersonal psychotherapy, or IPT, which is an evidence-based intervention for individuals experiencing bereavement. The World Health Organization recommends IPT as a first-line treatment for depression and has created an 8-session group intervention that has been successfully implemented by supervised health and aid workers who do not have specialized training in mental health.
Through community collaboration, focus groups, and a culturally responsive training program, our team of experts will equip paraprofessionals with efficacious strategies to support grieving members of their communities. We will examine the feasibility and acceptability of training community practitioners to administer IPT and the clinical outcomes of their bereavement groups. We will also explore the Tribute Program's ability to reduce risk factors associated with bereavement that place people of color at increased risk for poor cardiovascular health.